the 4-week rotation that I have students do with me is first of all, there'll be a fellow on the team, there'll be a resident on the team, there'll be medical students from the University of Texas at Houston. And then because I'm a director, I'm able to kind of tailor my rotation a little bit and have a few of you all rotate with me as well. So you'll get a chance to rotate with everyone at different levels of training. So you'll have a 4th year medical student, you'll have a resident who's normally a 2nd year, and then you'll have a fellow who's a 1st or 2nd year fellow. So you get a chance to work with people in different levels of training. One, two, you'll get a chance to work at the university hospital, and you'll get a chance to work at a community hospital. Now, let me tell you something that university hospitals are very different from a community hospital. A university hospital, you see patients that usually have better insurances, there are more facilities available, and things like that. A community hospital or a safety net hospital is where you see, more underinsured patients. In our particular case, you may see patients that do not speak English as their first language. You may have patients that speak a lot of Spanish. You may have patients who get completely lost to follow up. They come to clinic, you prescribe them something, 6 months later, they've not taken that medication that you asked them to take. So what rotation with me is, you'll get a sense of how to deal with patients in a safety net hospital, as well as a state-of-the-art big university hospital where you're doing state-of-the-art treatment, stem cell transplants, CAR T cells, and all of that. And then on the other side, you also get a chance to work at a community hospital. The other thing that I like for you guys to do is, again, do clinic. And I have you do clinic again in 2 settings. I'll have you come to the university hospital, where again, you see patients completely different to what you see in the community hospital. And then I'll have you do clinic with me in the community hospital as well, where you will get a chance to see those kind of patients. And for an example, when I'm in the community hospital, I'm seeing about 40 patients in a half day, right? So very much like India. In a university hospital, I'm seeing 8 patients in half day. We are making sure we're getting a detailed history. We are, communicating the plan with them. We are, answering all their questions and things like that. So again, in the outpatient setting, you'll get a good idea of how to work in a big university, state-of-the-art university hospital, and then how to work more in a community hospital where you see a large volume of patients, and within a short period of time, you need to try and get as much work as you can get done. So that's important. The other thing is, you'll get a chance to work with residents and fellows and things like that, present papers to them. So what I kind of expect from you all is, if you're talking about a patient, we're talking about a plan, to look up some material, look up a paper, look up a journal, and bring it up on rounds. It shows that you're very interested, it shows that you're academically oriented, and it really goes to show, reflect very well on you, and even the fellows and residents will really appreciate you doing that for them. So that's definitely something I would recommend you doing. So when you come in to rotate with me, I'll make sure you get a strong inpatient experience, again, both in a university hospital as well as in a community hospital. I'll make sure you get a strong outpatient experience. I'll make sure you get a chance to work with medical students. So you can assess yourself with the students that are rotating at UT Houston, which is one of like the biggest medical schools and one of the good medical schools in the United States. So you can see how you compare. You can take notes from them, ask them what they do different, and that will really prepare you to be a good medical student and good resident. You can see how the residents function. You get a chance to work with the fellows at MD Anderson, who are really the best fellows in the country. A lot of them have done PhDs. A lot of them are from Harvard, Yale, and really top institutions. So you get a chance to work with them as well. So I think overall, during the course of the rotation, I make sure you get an exposure to everything, so that then when I sit down to write you a letter of recommendation, I can give you a detailed letter of recommendation, so that when you apply for residency, that letter of recommendation can be read and it can get you an interview.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.